So today we're talking about dysphagia. Dysphagia has to do with difficulty with chewing, feeding, and swallowing. Although there are difficulties with chewing, feeding, and swallowing, oftentimes people do not associate those difficulties with the speech pathologist. As promised, I told you that there are 5 areas of speech therapy and that I would deliver them to you one by one. Today we'll talk about these difficulties and how they affect nutrition and even families and caregivers of children that have these difficulties. Dysphagia can also occur in adult populations, such as people who have experienced traumatic brain injuries, TBIs, or neurological injuries such as strokes. And even sometimes other primary disorders, such as dementia or Alzheimer's disease. At some point, they will often lose their swallowing functions. But today, my focus is on the pediatric population. It has been my experience to typically get children that are as young as 1 month old and about as old as about 7 that usually have these difficulties. The difficulties are usually associated with either autism spectrum disorders, sensory integration disorders, or difficulties with developmental delays relative to premature births. Most of the kids I see are typically delivered a few months earlier than anticipated. Let's just say a woman comes to me and she's had a baby that's about 24 weeks gestation, and she's practically 6 months pregnant when that baby is delivered. Well, the first thing we automatically think about is that some of the systems of the body have not had a chance to fully develop, and that's why they're called developmentally delayed, because this child was born before anticipation or earlier than expected. So some of those systems that may have some difficulty formulating themselves or finding solidarity, if you will, would be neurological system, which is relative to the spinal cord and the brain, the respiratory system, which is why a lot of the babies are born with respiratory issues, which usually later on are diagnosed as asthma, and then there's the feeding and the swallowing difficulties relative to sensory integration. I'm going to tell you all that stuff and what it means. When the babies are born, they are typically sent to the NICU, or the neonatal intensive care unit, where they will receive services from a speech pathologist. That therapist will evaluate the child's ability to use the lip, tongue, and jaw for non-speech tasks as well as speech tasks. Well, a non-speech task would be feeding, chewing, and swallowing. A speech task would be sounds like just making crying sounds or cooing sounds or any type of sounds that are associated with non-speech or speech tasks, I should say. So a speech therapist will look at that child, and typically by the time they're in the neonatal intensive care unit, which is usually a few hours or maybe a day or two after being born, they have what is inserted inside their nasogastric tract, a nasogastric tube or an NG tube. It goes through the nose and it falls like this all the way down through the esophagus and into the stomach, and it is a source of nutrition for them. Some babies are also fitted with a G tube, which is usually placed on the left side of the body, and that tube also functions as a nutritional source. And what happens is that once those babies go home and the therapists have worked really, really hard with them in the NICU, they try to transition the family and acclimate them to the way that this child will require nutrition, because these requirements for this child's nutrition are going to be very different from a typical child's requirements for quite some time. And then ultimately the goal is for that child to be able to not use the NG tube or the G tube for their primary nutritional source. And that's when a speech pathologist comes in. So typically once that baby is fitted with the NG tube and the G tube, they go home and speech therapy is usually recommended. Another way that speech therapy may become involved is that you may have a child that just does not have a really good time or is usually not really successful consistently throughout their feedings. And when the mom becomes frustrated and it becomes a source of contention and stress for her, she usually takes that baby to the pediatrician. The pediatrician will then look at a chart and determine if that child is getting adequate nutrition and if they are gaining weight and actually growing like they would or like they should as their same age peers. Now, if they're premature, they're already developmentally delayed, but there's still a certain growth spurt that they should actually show relative even to their same age premature friends or premature peers. So a speech therapist will come into play, and in a speech therapist office, that speech therapist is going to engage that parent in the 4 stages of feeding: the preparatory stage, the oral stage, the pharyngeal stage, and the esophageal stage. We are concerned with what happens prior to the food actually entering the oral cavity or the mouth. That's when we actually interview the parent and ask them about what is going on during that time and what the feedings are like at home. We want to know what levels of anxiety are experienced by both the parent and the child. And sometimes minor adjustments can be made to that area and to that phase so that the oral stage is actually easier to come by. In my office, we typically work towards sensory integration exercises or sensory integration techniques that will help a child make sense of their senses. So instead of just shoving food in their mouth, we'll take food and we'll take it and put it around the mouth, the oral cavity. We'll take the banana stage 1 or pineapple stage 1 and smear it on the child's hands, and we'll allow them to just feel that texture, feel the temperature, and even get a little bit of what that food smells like for increments of 2 minutes, 4 minutes, 6 minutes. And after they're able to tolerate 5 or 6 trials of actually just the food on their mouth and on their hands, then we move to the oral stage. Sometimes it's not about getting in the child's mouth, but it's about what you do prior to feeding that makes that transition even more easy. Once the food enters the mouth, we want to make sure that that baby is able to initiate a swallow in an adequate fashion so that the food doesn't sit in their mouth and drop down to their jaw or drop back behind their tongue and into their esophagus too quickly. Because if it does do it too quickly, or even if it does it too slowly, it can go in the wrong place and end up in the lungs via the trachea. So the speech therapist wants to make sure that all those things take place and that they do so in an appropriately timed fashion. Finally, the esophageal stage is where things that we can't see will occur in therapy after the swallowing mechanism is triggered. And sometimes if a speech therapist feels like, I don't know about that, he's swallowing too slowly, or maybe he's swallowing too fast, then we will refer back to the pediatrician, who will then refer that baby to an OMS, which is oral motility, or actually an oral pharyngeal motility study, sometimes known as an MBS, also a modified barium swallow study. And that speech therapist will then work with the hospital speech therapist to determine what's actually going on at this level. We can see here, but we can't see what's going on here. So that's when they will employ an x-ray technician, a doctor, and a speech pathologist to determine if silent aspiration is going on, if there's difficulty with the epiglottis covering the trachea. Lots of different things could be happening, and we can't see unless we have that x-ray. So those are the roles of speech pathologist relative to feeding, chewing, and swallowing. If you need more information, please email me at chelseamoore@divinespeech.com. I love to answer your questions. I will give you detailed information and help you as much as I can. And if I don't know the answer, I don't have a problem with telling you that I don't. I will refer you out to someone who can help you. You can also go to my page, www.divinespeech.com, or you can go to my YouTube page, which is where you are right now, Divine Speech and Language Services. Thank you so much for your time, and have a speechy day.